Close to 820 nurses, nurse practitioners, physician's assistants, and other healthcare workers and staff have stopped receiving paychecks from the Oregon clinic. That's according to a notice filed with the state yesterday and first reported on by the Willamette Week. It notes the temporary mass layoffs started last month and blames, at least in part, Oregon's restrictions on performing non-emergency surgeries and procedures, something Governor Kate Brown implemented as part of her stay-at-home order. The goal was to give hospitals the space, staff, and protective gear to handle an overwhelming surge in COVID-19 patients. A surge that hasn't happened, and officials say may not happen because Oregonians are doing such a good job at flattening the curve. The Oregon clinic telling KGW while the employees are not getting paychecks, they are still receiving benefits. While it is the largest one, this is not the only example that we found of nurses and healthcare workers losing out on hours, on shifts, on pay amid all of this. In fact, the union that represents Oregon's nurses says they believe this is happening more and more across the state. A rep for the Oregon Nurses Association told me about one nurse working at Columbia Memorial Hospital in Astoria.
She told us that she's afraid that she won't even be able to afford groceries, let alone the other necessities of life.
KGW reached out to that hospital too and got a statement back. The hospital confirming they are temporarily reducing 90 of their support and non-direct patient care employees. They write their collective bargaining agreement allows for this, adding CMH will provide any laid-off employee with 3 weeks' pay and benefits. Rachel Gumpert said the union is also getting reports of Providence canceling shifts of per diem nurses whose shifts are typically scheduled as needed. The hospital confirms that's true, adding, "We are able to meet needs with our regular employees." In short, Gumpert told me healthcare workers are angry and exhausted, especially after sounding alarms last month about a systemic shortage of masks, gloves, and gowns.
I do think that across the state, Oregon nurses are really questioning how much the system cares about them when their lives and their livelihood continue to be in jeopardy.
Throughout this pandemic, KGW has been committed to telling the stories of our frontline healthcare workers. And, to that point, we have a story up on our website right now, and it's on my Facebook and Twitter pages. The headline: Healthcare workers, we want to hear from you. And we do. So share it, post it, send it to your friends and loved ones who work in the healthcare industry locally. And remember, those who fill it out can remain anonymous. Maggie Vespa, KGW News.